I had a lady who I've treated under sedation now for over 10 years, nearly 12 years actually, and she saw me in my previous practice. It took her a long time to sum up the courage to come and be seen. When she heard about sedation, she was excited. We were able to provide her with all her dental treatment, and then something like 8 years later, she found me here in this practice and came back because she had some more dentistry to be done and she hadn't found anyone else who could do sedation. So we treated her again. Now, that's a couple of years ago now, and I've been trying to wean her off sedation because it becomes something that they rely on. And obviously I don't want them to rely on it. I want them to be normal, happy, non-anxious patients. And we've gradually given her more treatment without sedation. So she started off with Sharon Everett, our hygienist, and had a little bit of a clean. And we've gradually increased what we've done to her. And now she comes in for her dentistry and doesn't have to receive sedation. She's a little anxious, but she's not anything like she used to be, and wouldn't dream of having sedation now because she trusts us and she knows that she doesn't feel anything other than a tiny little pinprick when we give an injection, and that's it. So once the injections are in, patients shouldn't feel anything. Injections now, local anaesthetic now, is so much better than it used to be. The drugs are better, they provide very good deep anaesthesia in the tissues. They don't sting when they go in because they have a similar pH to the tissues, and it makes dentistry a painless procedure if it's done well and use all the appropriate medications and equipment in the way they're designed. So dentistry now has moved well ahead of what it was several years ago, and there are patients who are gradually accepting it, even though initially they needed anxiety control using IV sedation.